Hello, I'm Dr. Vanita Rattan. I'm a doctor but also a cosmetic formulator specifically for skin of colour. Today I've got the beautiful Dr. Vina with me. She's a doctor in the UK and we are doing an in-depth video on cuts and burns. All the common questions that you have: when do you go to hospital? What do you do when it's at home? At what point do you need to start worrying? Any rules of thumb that we can all learn about. So today's a really interesting video. It's one that we want to make for quite a while. If you do want to ask me questions, we are in the comment section for 1 hour at the launch of every YouTube video. So when you subscribe, make sure you hit that notification bell. You can also come and ask me questions on my Instagram, my TikTok, and also we have a private Facebook group. If you love skincare as much as I do, please do get your hands on a copy of Skin Revolution. It's a book that I wrote with HarperCollins and it's available on Amazon. So without further ado, let's dive right in. So my first question is, which part of the body bleeds the most and means that you really need to go to A&E?
Okay, so there are a lot of different parts of the body that can bleed quite a lot, specifically the head, neck and chest, because it's what we call a very vascular area, which means there are lots of blood vessels rushing lots of blood there. Have you noticed when you cut yourself on the scalp, you might notice a lot of bleeding, or like even on your fingers and toes?
Toes.
Yeah, so when you see bright red, fresh blood pouring out of a wound that isn't settling within 5 minutes, you need to call for help, depending on how deep the wound is. Doesn't necessarily mean you always go to A&E. You want to, depending on where the wound is. So give me a body part and I'll tell you.
Toe.
So if you stub your toe and it's bleeding, you take it under a tap, run water under it. You want to see the amount of bleeding reducing. You want to see the wound slowly kind of closing and the redness kind of reducing. If you see the opposite of all these three things, if the bleeding continues to increase, the area gets more swollen and bigger, or the wound gets gaping and bigger, you want to seek medical advice. What that looks like depends on what time of day it is and where you are. If it's between 9 to 5, you can maybe get an emergency appointment with your GP to see the nurse. If it's after 5, you might need to call 111. That can book you in to a local minor injuries unit at your local A&E. So that might be the quickest way to get it done.
Okay. So, as a mother, a lot of moms out there have kids who run around and cut themselves, and they can cut themselves in different parts of the body. It can look different ways depending on what they've done, and there's a lot of screaming involved as well. So I think the question a lot of moms ask is, what are the basic steps you need to do if a child has cut themselves?
Okay, that's a really good question, and it's very important, especially now, summer, the sun's coming out, everyone wants to run around. Well, first things first, safety. So prevention is always better than cure. We all know this. So if you have young children around, try and keep sharp objects, pointy, edges of tables and things protected so that you're already minimizing that kind of damage. But if children get cuts, again, depends on the type of cut and how much the bleed is. So if it's what we call a superficial cut, which means only the top layer of skin is affected and it's a small bleed, you want to first things first, get it under a tap. You don't want the water to be freezing cold, you just want it to be tepid. Yeah. Because if it's freezing cold, it causes the vessels to narrow or constrict, which reduces the blood supply and that can cause more problems. So you want it to just be kind of room temperature water, run it under the water so it's clean, and then maybe put a plaster on it. If that's, at your extremities, kind of a simple cut. But if we're talking about a sharp object, if the child is already on medication like blood thinners or specific cancer meds, then you don't want to wait. You want to call your specialist nurse or make sure the child gets seen on the same day by a doctor. Okay. And we worry about this because initially the wound may seem fine. You can get secondary infections. So if we treat it straight away, we could maybe resolve it with just what we call a superficial topical antibiotic cream. All that means is it goes on top of the skin, it's antibiotic, it will kind of treat it, the medicine that works. But if we leave it, they might then end up needing oral antibiotics or IV antibiotics in hospital, and that's something we don't want to do.
Absolutely. That's a nightmare. Okay, so the next big question is, if someone falls and they hurt themselves, at what point do you think, okay, this is a bone issue or is a soft tissue issue, i.e. I need help, or this can resolve at home by itself? Okay,
that's again a very, very good question. Especially if there are siblings involved, there will be a lot of falling and kind of tumbling involved. So a good way to look at that is impact and maybe even height of impact. So what do I mean by that? If someone's just maybe rolled off a sofa versus someone who's fallen off a slide, jumped off. Yeah. So straight after an injury, the great thing about children, they will be vocal about it. It's very rare that they will. It's very rare that you won't know that they'll be silent. So you already know there is pain involved. You need to go to them.
Yeah.
You want to firstly examine the child head to toe. Check, are there any bruises? Are there any swellings? Is there a change in skin color and change in temperature? The best way to kind of examine that is just from the back of your hand like this, and then you want to kind of frame their entire body, do you mind?
Yeah,
and just kind of go around the bones, because if there is a bony injury, that area would be swollen and it would be protrude out a lot more. So that's the first thing you want to see. You want to try and flex and extend their arms each and the legs, get them to just bend down and get up and move their neck in all directions, just to make sure they're fine.
Yeah.
If that they can do all of that, and in medical terms what we call, if they can weight bear, which means they can jump back up, skip along straight after the injury, or 4 days after the injury, that's fine. We're not necessarily worried about a fracture. We think it's soft tissue. Soft tissue is made up of your muscles, your ligaments, your tendons. Any of these could get pulled or bruised, and you can get a bit of pain. Paracetamol, ibuprofen, icing the area, never directly onto the skin. Cover it with cloth 20 minutes up to 3 times a day is amazing to reduce soft tissue injury, and just keeping it elevated to improve the blood supply. But if that's not the case and they can't weight bear, they can't get up and just kind of run and walk around, there might be a fracture. If that is the case, get them to pediatric A&E. We don't always x-ray children, and I think this is quite important. You know why, right? So parents, if a doctor says we don't need an x-ray, that's because x-rays are radiation. The more x-rays you have, it can have a cumulative effect to the point where in adult life, you may then end up getting certain cancers that we couldn't have even predicted, depending on how many scans you have in your life. So we don't always x-ray children, but if we're worried about a fracture, we do. And so if a doctor does that, then it's kind of warranted. And if there is a fracture, we kind of act on it quite quickly. We put a cast and we make sure the bone is healed very kind of in the right way, in the right form and structure. And it's important, and the good thing with children's bones is they're quite malleable, they heal really well.
Really fast.
Yeah, so you want to get the assistance as soon as possible. So that's in terms of soft tissue and bone. Obviously, if you have bone sticking out or there's a break in the skin, if there's metal involved, such as nails or iron rods, very important to see a doctor, because they might need a tetanus booster injection, depending on how many they've had. So that's really, really important to get. Specifically, just while we're on this, I know we're not talking about head injuries, but if your child has bumped their head and they suddenly vomit, have a seizure or a shake, or they get unwell in the next 48 hours, you have to take them to A&E. Don't wait at all. So if they've had a head injury where they've lost consciousness or vomited, you want to observe them quite closely for the next 2 days, just to make sure they're fine as well.
That's a really good point, actually. This is something that we just all fear, and it can happen, but you just need to know what to do in that situation. Okay, so my next question is about burns. So a lot of us have burnt ourselves with hair straighteners, I know I have, or curling tongs, or
I have too.
or even just when you're cooking and you've got boiling water. So the first question for you is, what are the 3 degrees of burns, and how do you identify it?
Okay, so you're a doctor who specializes in skin. Our skin is this amazing protective barrier that protects from infection and the outside world. When that barrier is damaged from heat, that's necessarily a burn. So burns are classified into 3: 1st degree, 2nd degree, and 3rd degree. 1st degree burns, as the name suggests, it's just when the top layer of the skin is affected, the epidermis. You won't see blisters, you might see redness, you will definitely feel pain because the pain fibers are stimulated. And these are the most common type of burns that we see. So 1st degree burns could be, you've touched an iron, thermal burns as we call it, straighteners, tongs, hot water like you said, flame maybe. What you want to do, you want to put it under tepid water, never ice cold water, never ice. You want to allow it for at least 15 to 20 minutes under that water to encourage blood flow. You don't want it to be ice cold water because that causes vessels to constrict, like we mentioned before, and we don't want that. We want it to heal quite quickly. After 20 minutes, you want to observe the skin. If it still is quite red and raised, you can take paracetamol and ibuprofen, as long as that doesn't kind of interfere with your other medication, if you are on any medications. If you're on things like blood thinners, you want to contact your doctor quite quickly because it could impact the way some of the other medication works. So then what you want to do, you want to ice it 20 minutes up to 3 times a day throughout the day. If the area gets sore over the next 24 hours, you can get topical antibiotics to help heal it as well. That's what you can do. We see some people using the freezing or cooling sprays. I wouldn't advise that in the first 24 hours because of the way people may use it. Might be too close, too far. You want to allow your body to do it. You don't want to restrict it with tight clothing. That's what you'd want to do. If it's a large surface area of a burn, I once had seen someone who'd place their entire kind of palm on an iron, but it wasn't for too long. It was kind of quick, but it was still. But because it was a hand, we had to send them to A&E. It was quite bad. But what you could also do to cool the area after water is you can apply cling film. But what you do with that, you never wrap it because then you're again constricting blood flow. You want to place it in layers. So if I've burned that area, I put one and then maybe another and another, and then you just kind of leave it
for
like that.
occlusion purposes.
No, so to allow the heat to kind of stay there, to allow blood supply to come, but you don't want to occlude it because if what some people do, they wrap it around and that tightens the area, so you don't want to do that. So that's first degree burns. Second degree, very similar. The management is also very similar. The difference is it's the epidermis, but it goes a bit deeper, and the skin's way of kind of reacting to this insult, as we call it, that is heat, is forming blisters. Have you seen them? So the blisters, they can be painful. Children that I've seen never find it painful. They always like try and pop it.
I've seen people trying to pop the blisters. What's your take on popping blisters?
I mean, some find satisfying. I necessarily
don't pop the blister. It's sterile.
So blisters can come up, but that's your body's defense mechanism to kind of protect that area. That's a second degree burn. Again, you don't want to pop it. You just want to apply cool water. You want to get a topical antibiotic cream. But if it's a second degree burn, I would see a doctor. I would, anywhere in the body, try and get seen by GP, do a video call on 111, or if it's a large area, just go to A&E. It's not worth waiting at home because then the damage done is too much. Because the pain fibers are the same fibers that also link in with your sensation fibers. If they are damaged, that area may never feel the same again. Or the way you perceive things might be different in that area. So that's something you want to protect. That's first and second degree.
Dehydration. So the more surface area you've burnt, the more chance of dehydration you have, which that's how you control it is with your skin. So I've seen that as well.
Have you?
But even I just remember, just had a flashback. I remember my brother when we were young. Remember the Chinese restaurants and they put the hot plates out?
Stop!
Yeah, and I don't know, every kid just wants to touch everything. I remember he was about 5 or 6 and his hand just went onto the hot plate and everyone just like gasped. Straight to the cold water, oh god, it's just a nightmare. I just remember. He's fine, thank God. Oh my God. He's got all these other problems, but that one's fine. Hope you're not watching.
But this is it, right? It's that impulse, you can't always control it with children, so it's important to have this information around.
It's so true. No, don't drink hot tea over your child. That's the other thing that happens.
Because when kids tug or kids pull, and that happens as well. Then third degree burns, so that's when actually you've lost the top, second and the deeper layers, the deeper fascia of your skin, which is a lot of the protective layers. Now these are surprisingly not painful. But don't be under the impression that this doesn't mean that there's damage. This means there's a lot of damage. Because the pain fibers have completely been snapped off, so you don't feel anything. The blood vessels completely get constricted, so they seem white, actually white or black, and it's much deeper. If it's a third degree burn and you see your skin looking like that, we can leave some images here, isn't it, for what it looks like. Definitely go to A&E as soon as possible. Don't drive yourself. Get someone else to drive you. Stay really well hydrated. Don't try and cover up anything. If ever the burns are because of a chemical, and this is specific to people who work in labs, you want to wash it straight away, again just with water, get the chemical off and then go straight to A&E, because that's what you want to do. So the burns we've talked about are thermal burns, which are heat, but then there are chemical burns as well. So that's something to be careful of.
I mean, even in our lab, everyone is covered, got gloves, full protective gear, so that there's hardly any skin showing, but it can happen. You splash into your face. So it's been amazing having Dr. Veena with us. Please do follow her, and we are both going to be in the comment section for 1 hour at the launch of the video. So if you do have any questions, please do write them down below. Thank you so much, and we'll see you next time.
Thanks guys, thanks for
Take care, bye.